So this part of the presentation picks up on analyzing data that you might have collected in through the prior methods that we discussed in the last video. So we're going to talk about the different types of qualitative work and then how we actually conduct a qualitative study. So the first type, I think most people are familiar with, and I've put examples so we could talk about them. And they're based on either projects my students have worked on or things I've experienced in the field. So participant observation is really being with a group, right? Being accepted by a group and then doing field work. So think of like some of the early anthropologists who studied groups and took field notes, understood their behaviors, how people gave meaning to things, right? And you really need to see and understand these events. So for example, someone says to you that, you want to design a study about how Navajo elders look at the Indian Health Service, which is a part of the federal healthcare system. And you want to look at that and understand and say, what's the relationship and how do Navajo elders, and elders is a specific term within the tradition that how they see this healthcare system. So what would you observe, right? Think about how this group was treated in historical context, what you would learn and how you would respect the cultural practices. So you may want to go to one of these Indian Health Service clinics or settings and watch the interaction between the providers and people of the Navajo Nation and see what's being talked about, what language is the healthcare conducted in, are there any understanding or questions about cultural practices or beliefs in preventative medicine or holistic medicine. So you really want to be there, be in it, and observe what's going on. The other type, and this kind of goes hand in hand with content analysis, it's document review. So you can get any documents you want and look into them, right? So you're collecting everything you can as artifacts and you're looking at it. So diaries, media reports, blogs. Think about if you're looking at understanding how rural nurse practitioners in the Western states, or this was one of my students' projects, to look at, how these rural nurse practitioners kind of helped towns and places when they were forming. And she looked at photographs, she looked at some of the nurses' diaries, she looked at records of the town when nurses opened up practices and had clinics to help people. So you can get all the information by looking at documents as well. And focus groups, these are something that you might be the most familiar with. A lot of times people think of them as marketing, where the individual will usually five at the minimum, but 5 to 8 individuals will sit together and someone will ask questions and people will give opinions. And the big thing is that you have to be a really good facilitator. If not, in that focus group of 8, you may have 2 people that are just sharing their views and they're dominant, but they may not be the views of the entire group. So you have to make sure that you are moderating the group so that everyone has a voice and everyone's opinion is heard. And let me give you this example, right? Oh, and also, if it's a sensitive topic, people do not want to share sensitive information in a group. So you might want to think about another modality or another method of collecting data. And this is one that's actually worked, although you could think it's a bit sensitive, but there's a new housing policy offer rent reduction based on people's income, but people aren't using it and you want to know why. So you may want to get people together and figure out why. And some people may say, well, the paperwork's too complicated. Other people may say, I didn't even know this program existed. Some people may say, well, I didn't want stigma, but you'll get a group of people together who will all give their opinions about this question. Oh, sorry, I went backwards, sorry. And then just like focus groups, I think interviews are the thing we're the most comfortable with. The difference is that in qualitative research, you can go off script, right? So active listening is the key. So when someone's telling you something, you have to hear what they're saying, but also think, is there something they're alluding to? And I'll give you an example. Somebody I interviewed said, I don't feel safe. I feel safe in my neighborhood. And I said to her, oh, okay, so you feel safe in your neighborhood. Do you feel safe in your neighborhood during the day? Do you feel safe at night? And she's like, well, maybe not so much at night, and then she began, so you're probing. And those probes really help you get at sometimes the most interesting part of the interview, and the part that the interviewee is really wanting to share. And we call them key informant interviews because if I'm interested in looking at a topic, I'm not going to interview anybody about it. And I'll give you an example. I'm working on a gentrification project where cities are being gentrified and older adults are being priced out of housing, right? And we need to know what's going on in this gentrification kind of process. So we're not going to ask everyone in a city because people may not know. And sometimes we've interviewed people and they're really not aware of the what gentrification is happening and what's going on. So it's not helpful. So what you really need to do is make sure that the person you're talking to is aware of the topic. So we really need to work with agencies or older adults that actually live in an area that's been gentrified and or people have been displaced from that area. So now we can apply it to this. You learn that a public health agency has really high staff turnover, right? Think about what kind of interview you'd use to figure out why people are leaving, right? So this agency has really high turnover, and right, like wink, wink, we've never been in that situation. I hope you've never been in that situation, but I've often worked in clinical and non-clinical settings where turnover was a bit high. So let's figure out how we learn about why people are leaving. So should we do a structured interview? A structured interview is the most formal, where the questions are identical across all interviewees. You use a questionnaire and it's the same. Huh? Should we use a semi-structured interview where we can go off script? So if someone's saying, well, I think burnout happens because there's preferential treatment, and no one else has said that, right? This is the first time you hear it. You might want to probe and say, so tell me more. What do you mean by preferential treatment? Oh, some people get to work remotely. Some people get the holidays they want. Okay, tell me more. So that would be semi-structured. And unstructured, it would just be like a casual conversation, but it's not, because in this, what differs from this versus a casual conversation is you are probing and gathering information while partaking in that conversation. So think about, what do you think is the best, right? You could use any of these, but think about which one would work better to figure out why people are leaving, right? If you think people are leaving for all the same reasons, it might be structured. If you're not sure why people are leaving, you might want to do a semi-structured and ask them, so tell me more. Oh, so people are leaving because there's preferential treatment. You're going to echo. Or if you're really not sure and there's like chaos and people are leaving this organization rapidly, you may want to use it unstructured. So think about the reasoning as to why you're picking the method that you would. And then quantitative sampling, right? It is non-random. The goal of qualitative research is not to generalize, it's to deeply understand a few cases and understand, kind of process. So no random sample, it's purposive, meaning we are looking at key holders, stakeholders, people who know and have the characteristics that we're selecting. And sometimes we say we're sampling until we reach saturation. So we sample people until we're hearing the same story over and over again about the topic, right? We call it convenience sampling, right? Meaning it's not random. So whoever answers the survey, whoever comes to the focus group, or it could be snowball, where you're doing interviews and you want to know the experience of somebody who's left an organization. and they have a particular reason. So you could say, well, do you know anybody else who's left for that reason? And do you think we could contact them? So it's like somebody recommending or sharing their expertise in finding other participants. And you have a lot of data sources. So you can use your field notes, right? Interview transcripts, historical documents, official documents, personal letters or diaries. You could even, data mine tweets or Facebook posts or, whatever you wish. And you can use photographs. So this is Photo Voice. And this was a really interesting study because these were older adults that were living in an area that we would call a food desert. So they didn't have access to supermarkets or sufficient like retail outlets for food. And they were showing that if you want to eat healthy, or if you're eating on a special diet, like a sugar-free diet, that actually your costs are much more. And you might not be able to see it so clearly, but this is the jam, right? So both of these are jam. This is the regular jam on this side here. And you can see it's like 193 for jam. If you want sugar-free or more healthy jams and jellies, it goes from like 228 to 332, 256. So you can see that price is much higher, right? And what we learned from this is that a picture is worth 1,000 words. So the person saying that to be healthy in my community and get access to food that will support my health and well-being, I have to spend more money, right? And that's the intention of their photo. So we can analyze photos, and the individuals who take them can analyze them. And then how do we analyze the data, right? We always want to go back and look at what we're analyzing and ask ourselves, who's talking about this? What are the main points? When are these things happening, and why are they important? And this is a screenshot from AHLT, but AHLT, NVivo, Deduce, maybe Max QDA, if you've heard any of these are all qualitative software, qualitative analysis software for analysis that we use with data. And what you see is that this is the text here. And then these are the codes we assign. So the codes are like a shorthand, right? So I'll give you the example from the study the study I worked on. So we had providers who talked about guidelines changing, inconsistent guidelines about COVID regulations, depending on facility, depending on day of the week, depending on who was present. So we took all of this and we said changing guidelines. So all of the text and all of their quotes were linked to this one theme of changing guidelines. And we usually start from the ground up and build. So you can take smaller codes and build them up. So for example, people were talking about teamwork being better, communication being better. And some other groups were talking about teamwork collapsing and, being remote, affecting teamwork negatively. And so you could take both of those individual codes, like positive teamwork experiences, negative teamwork experiences, and roll them over to a larger code about just teamwork experiences in general. And then your subcodes would be the positive and negative categories of teamwork. And we talked about this a lot in the beginning of our first lecture this week, and then in the beginning of our class, is that, qualitative work is inductive, right? But it also can be deductive. So this is kind of a trick question, or kind of a combination. So sometimes inductive coding, you don't know what the codes are. When you look at the data, you read the text that people wrote, you read the narrative, then codes come to mind, you see them. But it can also be like sometimes in content analysis, you might begin with codes already and say, I'm going to look through these transcripts and I'm going to look for positive telehealth experiences and negative telehealth experiences. So in the first set, when you're reading the data and you're pulling out themes about, guidelines being challenging, that's inductive. when you begin and say, these are the categories or themes I'm looking for, or codes I'm looking for, and you're sorting them, that is deductive. So here's a really nice FAQs, right? You begin to think about data in terms of the research question. You don't have to code every single section of data. It's ideal, but it's not practical. Can you have one excerpt or one sentence with more than one code? Of course you can. And I'll give you an example. So you can have, when they're talking about, guidelines changing and one facility having one set of guidelines and one facility having another and CDC having another, we have the code for that called changing guidelines, but we also have another code that's CDC regulations. So there are definitely two or more codes in there. There's no rule. It's less than 50. I mean, you don't want to overcode, but you want to have enough that, every aspect of your data is represented with a code. And oftentimes you can use both inductive and deductive coding approaches. So you can say, I'm going to look for these specific codes in the data deductively, but I'm also going to see what happens. And it's called in vivo, right? In live coding, and see what new concepts emerge. So both can exist together. And trustworthiness is just like validity, right? We have to make sure that there's accuracy in the processes that we're using when we use qualitative research. And some people say, well, it's more biased because the researcher's in it, but we're also in the quantitative realm as well. So even though we're in it, we want to show the reader or the person reading our analysis that we have followed some really standard systematic principles. So the 4 parts of trustworthiness, or qualitative quote unquote validity, are: is the research credible, have credibility? Is there transferability, dependability, and confirmability? Now they sound alike, I know. I've gotten that, throughout the years, but they each mean a different thing. So we'll go through it. Credibility means is the interpretation drawn from the text or the data? We don't want this to be, this is what the researcher wants, and they're retrofitting everything to meet their idea. And is there another way that what you're describing can be seen? So we think that it's complexity of guidelines, but could it really be something else? Could it be lack of communication of policy, right? You always want to look and say, we're interpreting it this way, but is another way possible? You want to have enough people, right? 30 to 50, could work. It's a suggestion. You want to triangulate. So if you come up with a theme or idea, you want to make sure that other researchers working with you see that the people experiencing it see it. And you want to keep journals, and you want to note, anything that you experience in the field that might impact your ability to analyze the data. And you really want to involve people. So when you find or you create analyses, you want to bring it back to the people you studied and say, does this make sense? Do you see yourself in these data? And these are the final 3. So if you look at transferability, it's not generalizability. So please note, these are very different. In a quantitative sample that's randomly selected, you're going to look for generalizability, right? So that's like a deal. But in a qualitative sample, you're going to look for transferability. So you're going to say, would this research be of benefit? So if I'm looking at a small sample of practitioners who worked with older adults during COVID in the United States, would that be relatable? Or is there anything in that study that researchers could look at in other countries, right, or other places? And then dependability, it's like you're always looking and saying, do the data reflect the findings? Do the data reflect the findings? So you make a code book and you say, anytime a practitioner mentions, difficulty with regulations, whether it be CDC or local, we're going to put that in the code that says, challenges with changing regulations, right? So you're noting all your decisions. And then you want to say with confirmability, have you limited the bias that you could interject? So Did you write your researcher's stance and talk about your role and how you felt about the topic? Did the research team meet to discuss how the data were coded and to discuss any differences of opinions they may have? And did you use any counter narratives or alternate explanations? So, for example, in the category that we had, or the code about burnout, we wrote a lot of quotes about providers saying how during COVID, they felt this burnout. They felt overwhelmed and overtaxed. But we also included a few cases where practitioners felt their teams actually bonded because they were forced to go through a traumatic event together and kind of work on their feet. So in many ways, we had some counter narratives that were just as strong, saying things did not get worse. They actually got better with the team. So you want to include both of those. And this is why it's important, right? That it's not this great divide between quantitative and qualitative work. It's not one is better or worse. Again, it's what is your research question? What are you seeking to find? How are you going to look at the data? How will you collect the data? What's your sampling strategy? When you make your codes, how will you ensure rigor or trustworthiness, that you have a process that you're following? How will you and your team work together to collect and analyze data consistently? So think about those things a little bit. And again, if any questions come up, please reach out. You can always shoot me an email. That would be the best. We can always meet on Zoom, whatever you prefer. And just think about how qualitative work can assist you or how you would use it in your own practice.